Can I just press on a point of clarification before I bring other colleagues in? You've mentioned, Mr Thompson, that it's already hundreds of millions that's been invested to date. Does that include things like actually planning for complex warehousing, including refrigerated warehousing and so forth, that you say is lacking? And what does it cover so far, and what do you anticipate is down the track in terms of total costs?
Well, I think we know that there's not enough cold chain warehousing in the UK today to cover the stockpiles we've been asked to build.
Yes.
So there is a request into government to support the building of additional cold chain supply. There's enough ambient warehouses, we believe, but there's not enough cold chain. So I think it's difficult to put a total number on it, because obviously individual companies have had their own costs. Although Pfizer posted a cost of $100 million actually in their latest quarterly accounts. So I think people will start to see things being posted in companies' accounts. I said, obviously there is the cost of stockpiling, which is a very significant cost. Secondly, companies have had to build duplicate testing laboratories on the continent. That doesn't sound very much. As I always say to people, when we do quality control, this is not somebody with a clipboard at the end of the line. This is building a laboratory. You take a medicine, you have to analyse it to make sure the active is exactly there in the quantity it's meant to be, and the medicine is working in the way that it should. And that's why patients can be really reassured that every time a medicine is going to work. So just between GSK and AstraZeneca, they've allocated over £100 million just to build duplicate laboratories on the continent, which is why we've been asking the EU to take the same decision that the UK have taken, which is to say the UK have said we will take medicines which have been manufactured in, say, the continent, we will accept them to come and be used for UK patients, as of course they are today, but in the event of a no deal we will continue to allow that to happen. The EU have not done that, and I think it obviously is disconcerting to companies as to why that hasn't happened. So our request is that they should do that. That has made a huge difference to our ability to supply in the UK.
Thank you, and I'll come back to the point about qualified persons and some of the other complications around that in a minute, but perhaps, say, Dr Davies, could you actually talk us through in more detail the situation for Johnson & Johnson?
Sure. So at the moment, our focus has been on increasing warehouse space, hiring additional staff, and also we've increased our transportation capacity by 15%. So the cost of that actually is 1.1 million spend at the moment. The issue I mentioned at the British Standards Institute and whether we have to move to another European Union-based notified body, that the trigger has not yet been pulled on that, but will need to be pulled very soon, and the cost of that will be between 40 to 50 million pounds to do that. We've also calculated that if there were a no-deal scenario between 2019 to 2025, assuming that at some point there would be regulatory divergence. I know the UK government said it would accept the CE mark, it would accept European regulation to begin with, but if there were to be change in rules within the European Union, and if the UK government were not to track with that, we've assumed that in our model, and cost increased to over £150 million by 2025.
Right, by 2025. And can I ask, when the government spoke about the contingency planning and things like warehousing and air freight, they mentioned that the cost of that would be reimbursed by government. Have you been given any kind of indication of what how that would work and how that would actually filter down through?
None at all.
How about yourself, Mr Thompson?
No, I believe it's still a conversation going on in government. What we'd say is that there are smaller companies who are finding this very challenging indeed.
Right, so they're not being, they could actually risk going under if it's not being reimbursed.
They just don't have a really effective cash flow when you're a small company, so these things are significant. So I do think it's in the best interest of the government to provide support for smaller companies and to ensure that there's effective warehousing available.
I think particularly unique about the medical device industry, Johnson & Johnson is kind of different in this way, but 98% of the medical device industry in the UK are SMEs.
Yes, thank you. And there may be aspects which won't be reimbursed. So, for example, you supply direct to the consumer in many cases for your products, don't you?
On our consumer side of our business,
Consumer
yes.
side of the business.
Yeah.
So will there be cost implications directly for consumers of that?
On the consumer side of the business, there will be supply chain costs. So there isn't the same issue of the British Standards Institute there, but there will also be approximately a 1% tariff increase if we fall under WTO rules.
Right.
And that will be passed on to the consumer.
Now,